it's the first weekend, we'll do very simple bone structure, and a lot of the name I ask you to put in is more the common names in English. Next time, we would learn their anatomical name. For example, the shoulder blade, we will call the scapula. So some of the names would be similar. So just to show you that there are actually two sets of name for the bones. The more English names and the Latin names. So let's start from the top. Yeah. So skull. Skull is a general name for all of the bones of in the head. Cranium is the same as the skull, but more around the brain. So not in the face. Yeah. This is the cranium. Here you have the upper jaw. Can you feel the upper jaw? Yeah. It's more the cheekbones and below. Yeah. Can you feel it here? Around your, almost like the base of your, the base of your teeth. Yeah. And the lower jaw here. So upper jaw and lower jaw. Yeah. Anything else? Upper jaw and lower jaw. Oops. Good. Now, can you feel your collarbones? Yeah? So, can you lift it and see that if it's sort of move, yeah? So, you have the collarbones and the chest bone. That's the flat bone here in the front. Good. And your ribs, yeah? Ribs starting from here, below, and how many ribs do we have? 12 pairs, yes? Good. So now let's look at the spine. The neck has also another name that's called cervical spine. Do you have the cervical spine here? Yes. So, and then it's the upper back, yeah? Or the same name for the upper back is the thoracic spine. And what makes the thoracic spine is that the ribs attach to those, as opposed to the lower back that has no ribs attached to. So this is the lower back, or it's called also the lumbar back, yeah? Lumbar spine, so lumbar spine. And then in front we have the spinal disc. I'll ask the camera to come closer, because the spinal disc is the place between two vertebrae. Do you see this gel type structure? So that's a bit of spongy, a bit of more gel-like that give you flexibility in the spine. Yeah? Coming even further down, we are not on the spine now, we're on the sacrum. And the sacrum is the bone between the two hip bones. And you can see it from the front even better. So this is the disc between the lower back, and that's the sacrum here. So it's quite a long triangle-shaped bone. And then below the sacrum we have even a smaller bone. Here it looks like one bone, but actually there is a bit of a joint between. And that's the coccyx. That's the remnant of the tailbone. Yeah? On both sides, here and here, we have the sit bone. So when you're sitting, this is the bone that contacts the chair. And this big bone on the side called the hip bone. Yeah? And you can feel it quite nice here on that area. Yeah? And the front part called the pubic bone. What do we have here? Rib 12, rib 12. You would see that interesting, some of the ribs, when they are attached in front, they are completely attached to the sternum, to the chest bone. But you see some of the ribs are incomplete, sort of, yes? They call the floating ribs, because they are sort of floating, they're not attached completely to the front. So it allows in this part of the spine more movement. We are getting into the upper limb, so arm. Funny bone is this bone. Yeah, it's called funny bone because sometimes you get like electric shock. Yeah, forearms, wrist bone, and then fingers. Yeah, and then here on the leg you have the kneecap. You have somewhere the femur. The femur is here, and this is the leg bone. And then on the heel you have the heel bone, which is that you're stepping on, and you're having the feet bone and the toes. Great. So you can practice it at home. You can download the same file and cut it and stick it on your flatmates or your dog. Yes, and see if it's actually the same anatomy. Well, more or less the same. Yes, they have skull, they have femur, and they have the rest. And next weekend, it's in 2 weeks, we will take it even further and look carefully at more the skeletal system. So we'll do a lot more in detail work for that. Okay? Great.
Question.
Yes?
Some of the slipped disc, is that something that can be treated with?
It's not a treatment.
Upper jaw is here. Well, that's, I'd say it's the lower, it's the upper, or is that the cranium? The cheek.
That's what I did.
Because all that bit's the lower.
Lower jaw.
Yes.
Spinal disc could be the bottom.
So where are you right now? Upper jaw, yeah?
What's this one? Cervical spine.
It's the neck. The neck is called cervical spine, cervical spine.
Related to your cervix.
Yes. Cervix is an area is like longer and narrower. So the neck is narrower. Yeah.
Excellent. Is that something around your... Is that your middle?
What's that?
Sacrum. Is that your middle?
It's in between the two hip bones. So you could see more on the back. Yeah.
Oh, it's these where your tail would be.
Yeah, so it's above the tail actually.
There?
So yes. Yeah. So do you see that this is the last lumbar vertebra? And then below that there is, so this is a separate bone and this is one bone, and the coccyx is actually a separate bone from that on here. Yes, he's recovering. Coccyx is the tailbone, is the one below, really to there. Yes, good.
You know that